Do you shake your leg when you're sitting? Have you been told you fidget too much? Chances are you've engaged in a type of stimming. You may even be doing it right now, but it's much more complex than you might realize. Let's dive in. Stimming is short for self-stimulation. Philip Fisser, a clinical psychologist of behavioral medicine at Cooper University Healthcare in New Jersey, explains.
It's any kind of repetitive behavior that is usually aimed at things like controlling the level of stimulus in an environment or helping to self-soothe.
Stimming is commonly associated with developmental disorders like autism. In fact, the DSM-5 includes stimming as a diagnostic criteria for the disorder. When people with autism stim, they might do it in ways that are disruptive and less socially acceptable, like hand flapping, rocking back and forth, or repeating sounds or phrases. So, why do some people stim? Stimming is a way to regulate stress and emotion. Some people stim because it helps with sensory processing or aids in social communication.
When people are engaging in any one of these broad categories of behavior, which can include things like tapping, rubbing hands. Some of the ones that people most commonly associate with conditions like autism spectrum disorder are things like hand flapping or jumping up and down. Those types of behavior usually are to help the individual manage the stimulus in the environment, the level of stimulus in the environment. Or to in some way regulate, and sometimes even to communicate. So if this is somebody with something like autism spectrum disorder, sometimes verbal communication can be quite limited. So stimming is another way for them to communicate to those around them what their experience is and what their needs are.
What makes stimming soothing and enjoyable? Well, it's not exactly clear why stimming feels good, but the behavior helps activate the many neurotransmitters, aka brain chemicals, that regulate our emotions. Dopamine, serotonin, and glutamate are the main neurotransmitters associated with self-stimulatory behavior. Some people who stim report a creepy crawly feeling under their skin that only stimming can relieve. Engaging in stimming offers relief and pleasure, but it could also be reinforcing the stimming behavior, creating a cycle. In the past, people who stim used to be encouraged to unlearn the behavior, sometimes with the help of therapy and/or medication. These days, most clinicians have started to accept stimming and believe it doesn't need to be restricted if it isn't causing harm.
So whereas historically treatment has been very much focused on let's extinguish, now it's let's help the person understand the function, let's help them build the insight into what the function is. And if they can continue to do it and do it safely and it's, achieving something positive for them, then great. We're trying to really make this push toward education to let people know what stimming is, why it occurs, and that it should be accepted as it is, rather than extinguished when it's not doing any harm.
And because stimming is a coping or communication skill, it can actually help you learn more about what triggers your emotions or feelings of being overwhelmed. Wondering how to stim safely? First of all, make sure you aren't causing harm. Get help if stimming leads to pain or injuries, so you can develop healthier coping strategies. When you stim in public, experts suggest carrying a card that explains your behavior, communicates your needs, and reassures those around you that you're safe. This card can include information that educates those who aren't familiar with stimming. Ultimately, don't let others shame you into changing harmless behaviors, but don't feel ashamed if you've decided to mask your stimming in certain environments or want to modify or stop doing them. The choice should only be made by you.